And we're back, and today our special guest is Dr. Gloria Grimm, the Director of Health Services for the Cherokee Nation. We're very glad to have you here today.
Thank you, Jerry. I'm very glad to be here.
It is an interesting time in healthcare. A lot of changes going on.
Yes.
The Cherokee Nation delivers a huge level of health care throughout eastern Oklahoma,
Yes.
in many different communities within the Cherokee Nation and within northeastern Oklahoma. Let's hear just kind of a brief overview about how that health care is delivered.
Okay. We serve patients in our 14-county tribal jurisdictional area, as well as many patients outside that. Within our tribal jurisdictional area, we operate a hospital, which we recently assumed that's here in Tahlequah. It's a 60-bed hospital. We do inpatient services, surgeries, do lots of OB deliveries there.
Lots of those.
In addition to that, we have several primary care clinics in 9 locations. We can start out, we have Muskogee, Sallisaw, Stillwell, Nowata, Bartlesville, Veneta, Jay, Salina.
I know you're getting ready to build a new one.
We are. We're very excited. I don't know if you have had the opportunity to visit our Muskogee clinic.
Absolutely.
Our Muskogee clinic is right now our flagship clinic. It's about 100,000 square feet, very nice, very large, and we're able to deliver a lot of health care out of that facility. We did that under a joint venture with the federal government, with the Indian Health Service, which basically means that we pay to construct the facility, but they're paying for the employees within the facility for the next 20 years. So they give us money for that staff. We have a very similar arrangement that we're getting ready to start in Veneta. We have been finalizing the architectural design of the building, hope to be able to get that started within the next 6 months or so. And again, we're going to construct about a 75,000 square foot building there.
It takes a lot of planning to put all those pieces together for health clinics throughout eastern Oklahoma. Tell us a little bit about the number of employees, the number of patient-clinician encounters, those kind of things, because I think the public's going to really be impressed and surprised how big it is.
We have about 1,800 employees now in health, which is a phenomenal amount. When I started here about 14 years ago, we were around 500 employees in health. And one of the initiatives that the chief has expressed in his tenure as chief has been jobs, community, and language. And you know, health can really contribute to that. And right now, you can see through jobs how we've greatly contributed to that. So, having said that, with 1,800 employees, we're able to care for a lot of patients. Active patients, we have about 130,000 active patients who come in and out of our doors every year.
Huge.
So we see an extraordinary amount of patients. We, take care of patients from birth to death, and all parts in between. So we're very, very proud of the quality of care and the quantity of care that we deliver.
I know that in my previous job in the Oklahoma College of Optometry and traveling all over the Midwest and nationally as we were doing training and displaying some of our scope of practice that we do in Oklahoma, which is rather unique in the United States. The whole country was impressed with this marvelous partnership that you've been a big part of between the Cherokee Nation and also with the Oklahoma College of Optometry. You might share with our viewers just a little bit about how unique that is, and the number I was given by Dr. Welch is we're probably going to be around 50,000 clinician encounters among all the clinics.
That's correct. We have had a long-standing relationship with the Northeastern State University School of Optometry from its inception, and there were some very insightful people many years ago, 30 plus years ago, who saw the need for eye care in northeastern Oklahoma and in Cherokee, people. There were at that time, and Dr. Welch says this often, people would come in who had never seen an optometrist, who had never had their eyes examined. And people were losing their sight from things that were preventable. So we wanted to stop that. Now we have developed a relationship, and it's a mutually beneficial relationship. We have patients, they have doctors and doctors in training. They come into all of our facilities. We have rooms for them to see patients. They see patients. They are able to prevent eye disease, make sure that people can see, children can see. we have just, it's been a fabulous relationship. Dr. Seiert, who recently retired, has been very responsible for vision in children within Cherokee Nation. She has partnered and been very responsible for helping us in our Head Start programs, making sure all of our children are screened, that they get proper eyewear. And, you know, it will be a relationship I expect to continue well into the, you know, several more decades.
And just a statistic that Dr. Seiert shared with me one time was that their observation is that someplace around 25 to 30% of most children that they screen and examine 6 years and under have some kind of vision need that if it had gone undetected would affect their educational progress, their social development. So what a marvelous asset for the Cherokee Nation.
It is, and I think, you know, until that program came along, I think a lot of learning problems that children were having were probably caused by their eyesight and their inability to see things. And then once we were able to appropriately diagnose that, it's really helped academically as well.
It's a win-win kind of program that everybody benefits from throughout the Cherokee Nation, but especially the children.
Yes, definitely.
We're going to take a quick break and we'll be right back.